I'm here to explain the gap between knowledge and skills. As you all know, knowledge is knowing about something. In medical education, we can call it as a theoretical knowledge. Whereas skill is doing something. Now, I want to raise this issue because there is a lot of misunderstanding between acquiring knowledge and acquiring skill. And the confusion is increasing actually day by day. Students and many medical educators feel that if a medical student is able to explain things, it's sufficient that he has adequate skill. That's not true. I'll just give a simple example. When you ask a student to write the steps to be followed in recording a blood pressure, he may write it perfectly. But when given a real patient, he may falter in doing so. So applying the knowledge you gain at the bedside is skill, and that requires a separate kind of a training. From a patient perspective, what is important is the skill of an individual. Knowledge is important, but the applied knowledge is more important, and more than that, your ability to do things is important. So with this in mind, right from your first year MBBS, ensure that every day you think that am I looking at any skill on a given day? An anatomy student may get confused and ask me that how do you expect me to have a skill? Dissection is a skill. Identifying a particular muscle is a skill in the specimen. So knowing where the muscle is the knowledge, but identifying the muscle is the skill. So at every branch of medicine, there is scope of gaining skill. So ensure that you tune your knowledge in such a way that it leads to skill. And skill is something you need to do it again and again. The more number of times you record BP, more number of times you are good at it. More number of times you put intramuscular injection, more skill you have. So any skill which is done at the bedside to the patient has to be done multiple times. And every time you tend to improve more and more without you actually knowing that you are improving in that skill. So I want to stress again that the medical students as well as the medical educators should strive to strengthen the skill of a medical student, which is going to help the community at large. Thank you for your patient listening.